Just a note here to our media also, we have a hard stop at 4 o'clock today. We will try to get to as many of your questions as we can before. I won't talk very much, and I will let the media questions, but just please remember, we have a hard stop at 4 o'clock today, and we will start here shortly. Thank you. Good afternoon. This is David Henry, Communications Manager for the City of Amarillo. I want to welcome everyone to this special news conference today. We are joined by Amarillo Mayor Ginger Nelson and City Manager Jared Miller. Let's go ahead and start this time. Let's go ahead and, since we don't have a whole lot of time due to previous engagements, let's go ahead and take questions. I'm going to go ahead with statements also from Mayor Nelson and Jared Miller. Then we'll take questions from the media. Excuse me. Let's go ahead and start with Mayor Nelson. Mayor, how are you? Good afternoon, Mayor. How are you?
I'm good. Y'all have video? No?
No, we do not.
Okay, so just voice.
Yes.
Okay, great. Well, I appreciate you guys joining us today just to get this information out. Been some questions about the morgue units, and we've had a lot of resources deployed to Amarillo in response to COVID with so many of our hospital workers quarantined. We've had a lot of healthcare workers come to our area, and we appreciate those state resources, and we get those through the Panhandle Regional Advisory Council, which you hear staff reference as the RAC, the Regional Advisory Council. So another resource that's coming through the RAC is additional capacity to help support our morgue, which at our current caseload is not able to handle the volume of people who are dying of COVID in our city. So we're really grateful for the RAC resources, and really sad that we need those additional resources. But I think what's important is that out of respect for the families who have lost loved ones, we want to respect the use of those resources. And so, not really going to be appropriate for us to talk about specific locations or how those resources are implemented or operated. But what is important is for citizens to understand that the COVID surge in our city is very real, and there are very difficult consequences because of our COVID numbers. And what's of the utmost importance is that we need to slow the spread of COVID-19 in our city. And the best way to accomplish that goal is to wear a face covering. So, please, if you live in Amarillo, we're asking you to help us ease the burden on our healthcare workers and our hospitals. And it's really as simple as just wearing a covering over your face.
Thank you, Mayor Nelson. Let's go ahead and open it up, since we don't have a whole lot of time here. Let's go ahead and open it up to questions from our media. Let me go ahead and start with, if I'm not mistaken, we have David Gay from Amarillo Globe News. David, how are you?
Good afternoon, everybody. I guess my question for Mayor Nelson is that in your statement last night in your Facebook video, you stated that there's currently a mobile trailer, and you guys have requested a second trailer as you guys wait for a portable morgue unit to come to Amarillo. What is that timeline for when that portable morgue unit will be in Amarillo, and with the city having to utilize these mobile trailers?
I don't have specific information about the operations. There's a local company in town who works with the RAC, and they're coordinating all of that strategically to meet the needs of what we have in the city. And that's their job, and they're the ones who are experts at doing it. So as far as timelines and any operational questions, I don't have that information, but what's most important out of it, David, is that Amarillo needs to know we're having to request these resources, and we need to use that as a wake up to get our attention, to change our behavior, and for people to start wearing masks and canceling social events and doing a better job of slowing the spread of COVID in our city.
So there's no word from the state or anything like that about their involvement in this process.
They're involved just through the RAC as coordinating those resources, and they're working with our local companies who, are the last responders to the COVID pandemic. They're working with those last responders to strategically establish those resources in our city and operate them in a way that meets the needs that this COVID situation is causing.
Okay, that's all the questions I have. Thank you all.
Thank you, David. Let's now go to Morgan Durden of KVI Channel 7. Morgan, how are you?
Good, how are you?
Good, thank you.
Good.
Go ahead, Morgan. We're sorry we lost you there for a second.
On your Facebook, Mayor Nelson, on your Facebook video, you said Governor Abbott is the one with the authority to shut down Amarillo. I believe that's true, but you said you don't know when that would be, why, or what it would look like. Have you been in communication with him, and why don't you know these answers?
I have not been in communication with him. He is busy handling things on a statewide level. And what I feel like is that if our citizens would wear face masks, we would be solving our own problem. So I don't see that there's an action step that the governor needs to take other than what he's already asked us to do. And that is through his GA 29, he mandated wearing a face mask in a public place. So he's already asked us to comply with that. And we here in Amarillo need to respect his authority and comply with that. It's for our own good. So we really have the reins in our own hands to manage the things in the city. There's not really a reason for me to ask the governor to step in. In addition to that, I think, shutting down businesses and schools, that is an extreme measure, and it's very costly on many fronts. We must take seriously what the COVID numbers are doing in our city, but what we need to do is match the solution to the problem. We don't need to overreact with a solution that creates other problems that do other damage. We just
all right. And my second question, you said leaders and business owners who are hosting large gatherings are increasing the COVID-19 infection rate, even with masks and social distancing. Some pictures from Thursday night's rodeo performance, majority people are sitting close together with no mask. Why didn't the city choose to cancel or move this event?
Now the event went at the point that we began shutting down city facilities. We stated from the very start that it was going to be a phased approach. One of the reasons for that, and the primary reason for that, is because of agreements that we already had in place at the Civic Center. Our agreements require a 30-day notice from our from the event to be able to cancel the event, and we're doing the same thing. We spoke to every single event that had events planned during that window until the end of November, and a number of them were willing to cancel, but some were not. So we're working with those events to make sure they're as safe as they can possibly be. With regard to whether it's baseball games or rodeos or things like that, there are protocols from the governor's orders that allow when people get to their seats to take their mask off when they're sitting with their family groups. Now, I can't say that every person sitting there watching the rodeo is with their family groups or not, or that they're 6 feet distant. But to see someone not wearing a mask while they're watching the rodeo is not necessarily an indication that they're in violation of the governor's order. However, walking around within 6 feet of non-family members inside the display areas and other things like that would be something that we need them to work with us on.
Now, let me just say, there's no easy option here. And I see this from a leader's perspective. It's not easy to cancel your event. It's not easy to move forward with your event. There are many perspectives that are unique to each organization and the events that they're managing. And so as a leader, I feel the burden for each one of the leaders who are making those decisions. There's no easy option here.
And it is a hard decision to close businesses. You know, you said it's vital for the rodeo and those individuals to make their money. But have you thought about the bars that have been closed that aren't making money, concert revenues and performers who are getting sick and can't work? They aren't making money either. So why are we making this exception for the rodeo? I know you said 30 days, but I think we were in critical condition or leading there 30 days ago.
Yeah, we're not making a distinction between bars and the rodeo. The bars are not allowed to be open because we're an area of high hospitalization. Once we went over 15% on our hospitalization rate, according to the governor's calculation, bars aren't allowed to be open. So,
and that's under the governor's order.
Yeah, that's per the governor's order. So that's not a discretionary thing.
But don't you think there's a reason that you have a hospitalization rate this high that the bars have to be closed, and that's why those events are closed, but we still have a rodeo?
Right.
And that's why we visited with all of those event organizers, gave them the facts, and we understand how hard it is to make that decision.
Okay, so we're basing on technicalities that they follow the rules. And then my last question is regarding the morgue trucks. I actually did call the morgue today, and they said that the trucks came 2 weeks ago, or a week ago, she said, and another one arrived a few days ago. So that one's already here, the second one. I was wondering why this wasn't mentioned earlier in a COVID presser or conferences when the city says it's being transparent.
Well, the city's the one that mentioned it. The mayor is the one that mentioned it. So,
for one thing, this request didn't come from the city, Morgan. This request came, through the RAC, working with these last responders in the community. So as soon as I found out about it, then I began to be able to just talk about it and let citizens know it's an important part of what's happening in our city. But this is not, the city doesn't cover the last responder function of the COVID pandemic. And so we weren't, we're not the ones that requested that.
Thank you for your questions, Morgan. We need to move on now in the essence of time. Go to KAMR Channel 4. I think it's Aaron Langston, if I'm not mistaken.
Hi, it's Kaylee Green. Thanks for having me, Dave. Good. I'll be quick since I know we're running out of time. So this question is for Mayor Nelson. So you mentioned last night, we're asking the public to wear masks. And in the past, we haven't seen that behavior change. People have mostly not been wearing masks, not canceling social events. If the public doesn't start to wear a mask now, what's next? What can we do?
My job as the mayor is to make sure people have the facts about the current situation in our city. That is part of the reason why I wanted to talk about the mobile morgue units as soon as I heard that we had those in our city. It's an important piece of information that tells a part of the story of what happens with the COVID pandemic. So we're looking for traction to get people's attention, to get them to engage and thoughtfully consider what their individual actions are, whether they're choosing to go to social engagements. Maybe they're a leader in the community and they have influence over whether or not those events are happening. Anything they can do to limit the spread of COVID is something that helps our hospital, and I appreciate that as an elected official in the city.
Kaylee, thank you very much. Let's now go to KFDA News Channel 10. I'm not sure who we have on here, but let's go ahead and open it up to KFDA Channel 10.
Hi, this is Francis Casado. I was wondering, since you're saying that we're having to request these resources, is the morgue then at capacity? What's the capacity right now for the morgue?
Jared, you want to talk on that? It's not city operated, so we're operationally not going to have that information.
Yeah, we don't have a morgue, don't operate the morgue, so I don't know what the capacity is. And I don't know if there's different time periods that are being dealt with for each deceased person that one of the causes of death, or the cause of death on this was a pandemic condition. So there might be different conditions as far as timing and how long that we need to maintain possession before the families can conduct their burials or last rites. Dr. Milton might have more on this. I don't know if Dr. Milton is unmuted or can unmute.
Yes, Dr. Milton, are you there?
Yes, I'm here.
Yeah, go right ahead, please.
I don't have any other information on the morgue capacity. I don't.
Okay. Let's go ahead and close it because we're running out of time here for our media questions. I think, Dr. Milton, you had something you wanted to add, though?
Yes, I don't guess we have visual here. I don't guess you can see here, but I'm once again in the COVID ICU, and I've got on my N95 mask and I've got on my face shield, and I have various nurses around. They've gone back to the bedside. I think they've gotten real busy. But I wanted everyone to understand that this is really a critical situation, obviously, when we're talking about increasing our morgue capacity. I do have a nurse here who just wants to say a word just about how things are going to maybe ask people to continue to wear a mask. Just so you go. They can't see it.
Hi, this is Shelby. I'm one of the travel nurses. I've been here for about almost 4 months now. I want to tell the community to continue wearing the mask and a social distance. I know there's some events coming up in the holiday season, but right now the hospitals are so full that, our resources are, becoming really limited. And so in order to protect yourselves and the health of your loved ones, to please social distance and stay home, wear your masks. Up here at the hospital, we're tired. We are so worn out just from all the critical patients, and we just want to protect everyone and help everyone. We can only do so much, so we need you guys to do your part.
Thank you very much. We want to thank you for your service and what you're doing during this time. We know it's quite a burden on the healthcare industry right now, and we appreciate everything you guys are doing. That's going to go ahead and conclude our news conference for today. This is David Henry. I'm the Communications Manager for City of Amarillo. I want to thank the mayor. I want to thank Jared Miller and our panelists who joined us today and our media members. We will see everybody next Wednesday. Thank you.
Dave.